Hello, this is Eric Christensen with Healthcare Compliance Pros. I want to welcome everybody to our webinar today. It's kind of an emergency webinar on Section 1557 of the Patient Protection and Affordable Care Act. We'll be doing some education, some materials, and also providing you with an opportunity to do some Q&A on how Section 1557 will apply to your practices. Okay, so like I said, I've introduced myself. My name is Eric Christensen. I'm the Director of Client Services. Chad Schiffman will also be on. He is our Director of Compliance. And I'll be turning to Chad for a little bit of information on specifics on how it necessarily impacts your practice. So we did this webinar actually we got done with this webinar about 15 minutes ago. That we did an emergency webinar for the members of the AOE, or the American Association of Orthopedic Executives. That webinar went really well, and hopefully we'll have some great questions here. In fact, we had more than 100 odd attendees at the AOE webinar that just concluded, and more than 50 questions that were answered as part of that. So we need to make sure that your questions come across, and we will answer your questions in line. Okay, so as they're applicable, we may defer the question depending on the question, because it may apply to information that occurs later. So what is how does Section 1557, or specifically your requirements for those, impact your practice, and are going to be impacting your practice relatively soon? So, well, the Office of Civil Rights, and part of the passing of this, is to make sure that we're communicating effectively in providing patient interaction or patient services. And, you know, we think, or they think, that communication gives us a better understanding of ourselves and those with whom we interact. So this idea of communications and correct communications are part of how we're impacting Section 1557 as it applies to our organization. So what is specifically Section 1557, and how does it apply? Well, it is the non-discrimination provision under the Affordable Care Act. Now, this went into effect in 2010, but there has been a final rule that was adopted and was effective July 18th of 2016. Well, how does an effective date of July 16th, how is that impacting me now? And why is that necessarily such a requirement that seems to be a buzz for everybody? Well, there was a 90-day implementation standard for that, and because of that 90-day implementation, we have until October 17th to get a non-discrimination statement posted. Get the posting pasted to our website, do a statement of non-discrimination, which is different than a notice, and we're going to be going into that, posted on any communications, and we'll talk about what type of communications are required to have that posting. So the law prohibits discrimination based on race, color, national origin, and we're going to be specifically talking about the ability for you with limited English proficiency. And as we talk through this, that concept of limited English proficiency is going to be part of how it impacts your practice. So what are the requirements? The enforcement was through the HHS Office of Civil Rights. That's how it's going to be enforced with this specific accommodation as it applies to Section 1557 of the non-discrimination program. So there are questions that are coming in already. Those questions will be answered, and I will make sure that they're answered as part of this process, okay? So Section 1557 applies to all health programs and activities for which federal funding assistance is supplied. Now, as it relates to commercial payers, we know that in the state of California, there's specific requirements to provide language translation services for all medical care. There may be discrimination policies or discrimination statutes that exist both state and federally for providing translation services as part of non-discrimination. But how 1557 applies specifically is to those groups who receive federal funding as part of their process. So if you're a CMS provider, if you're receiving federal grants, if you're providing money with regards to community health services, Department of Defense services, anything in which federal money is being provided to you, you're required to comply with Section 1557. So I'm assuming that out of the more than 200 attendees to this webinar, the majority of you fall under this standard. And not only does the standard apply to that, but it applies to anybody who is participating in state-based marketplaces as well. So we've got a federal standard and we've got state-based marketplaces under the Affordable Care Act. Okay, so yes, I just included a nice question that came in with regards to state-based marketplaces, including state-based Medicaids, because the Medicaid funding is actually generated federally for the most part as well. So we want to make sure that that's all applicable to here. So we're going to assume that the majority of the people on here are required to participate. Now, what is the standard? Well, there's some standards on notification postings. There's some standards on statement postings. There's some standard on providing language translation services. But most of the buzz right now has been about this idea of what is the notice, okay? You're required to create a non-discrimination notification. It must be in a conspicuous location within your organization. It could be posted on the reception desk. It could be posted on the wall next to your patient rights, next to your notice of privacy practices, which I hope has been updated and is posted conspicuously as well. So wherever you're at within your interaction with the public. If you have multiple locations of care, it must be posted. We had an earlier question of my clinic exists within the hospital setting, but I'm within my own space within that hospital setting. Doesn't the non-discrimination statement of the hospital cover me as a practice? No, it doesn't, because your statement needs to reflect information specific to your practice. We're going to talk about the information that needs to be on that notice of non-discrimination. Okay. A smaller notice or a smaller statement is included in any significant publications. This would be billing statements, new patient intakes. OCR has clarified this to include any marketing materials. So just like banks, insurance companies, any of these other groups that have the smaller language, smaller 6-point type at the bottom, now we're starting to get into those where those publications that you're sending out to patients need to include a statement that your practice does not discriminate based on, and we're going to show you examples of the statements as well. But that statement needs to be on that on those significant publications. Now they don't define significant publications, but again, that would be any new patient intake materials. You can have statements beyond any information that they may be filling out. The notice of non-discrimination should possibly be as part of your electronic intake with your patients. So if they've got a notice of privacy practices acknowledgement, and you can combine those acknowledgements, so you could have a single statement that includes all of that information. I acknowledge the notice of privacy practices, and I acknowledge your notice of non-discrimination, could be contained within the same statement. You're doing financial disclosure and financial responsibility acceptance. That could be part of that electronic or paper onboarding with the groups. Now, there is not any specific reimbursement process for this, so this is just, again, if you're receiving that federal funding. So we've got the smaller notice that's on publications. We've got the large notice that needs to be published and posted conspicuously, not only within the practice, but it needs to be on your website and accessible from the home page. So on a lot of your websites, you're going to have a footer at the bottom that has some legal disclaimers, has some legal language, maybe even has a site map. You can have a direct link over to that with regards to that. So with regards to notice of non-discrimination, is there any information that I haven't covered here, Chad, that you thought was expressed in previous webinars that we've done?
Sure. I would just say the one thing was that on that smaller notice, just OCR said that you could use up all your current publications first, that you'd want it to go out on all your future publications and communications. So in other words, you don't have to run that out to the print shop and reprint everything right now. You can use up what you have and then add that to your future mailings. So.
And then again, with regard to this, it's your notice of privacy practices. So if you're within a larger facility, but there are separate intakes that you do with the patient and notifying them of your services, you have to provide these translation services. They may not be provided as part of that larger facility or the larger clinic that you're in. If you're doing a patient intake, you need to provide your own notice of privacy practices your notice of non-discrimination. Sorry, I do a lot of compliance, so notice of privacy practices just came out of my mouth. But notice of non-discrimination must be posted as part of that. And because that's unique to you, there's some specific information that's contained as part of that notice of privacy practices. Now, we're publishing a white paper that'll be available to you at the end of this. It has some links. And those links allow us to talk about what is required as part of this process or of this notice. Okay, so let's move over to some of those links. Here's an example of a notice of privacy practices. You'll notice that you are required to indicate who your compliance officer is, how to contact your compliance officer, what type of information or what type of language assistance services that you offer. Also, if you need language assistance services, who do you contact to request those? So again, if you're inside of a larger clinical setting, they're going to be requesting those services from you, and you have to be ready to handle those requests to meet that requirement individually within your clinic, even if you're within a larger clinical setting. You also have to have some specific language. Now, this language has been specifically taken from the federal requirement. So from HHS, and again, this will be part of that white paper. Let's see if I can move over to that page. HHS has some resources for covered entities. They have information as required for the languages that meet those state-specific requirements. Also included in those links are, for every individual state, the languages that you need to post, and post what are known as taglines, and we'll talk about taglines here in just a moment. Additionally, there is information on what is required as the statement. So there's a notice that gets posted with regards to your non-discrimination. There are some taglines that are posted as far as the taglines for requesting services for the 15 languages in your state. But additionally, on those communications, you have to post the taglines on significant publications that, for example, Healthcare Compliance Pros complies with applicable federal civil rights laws and does not discriminate based on basis. And this is a sample, again, of what that information. Now, you've seen this. You've seen this, again, on information that comes from larger organizations or institutions. Now they're just bringing it down to that medical level. You would have seen this on your bank statements. You would have seen this in on your letters from your insurance companies. Those are things that we're having to provide now as well. So what are taglines? So we post the notice, and that notice included information about what you're doing, but beyond that are what are known as taglines. Taglines are information in that specific language, those 15 languages, that need to be included in your notice, written in one of those 15 languages, on how to request language assistance services. So, for example, if you speak Chinese, language assistance services are available to you free of charge, and the contact number to request those. Now, it also includes in the example a TTY number for hearing disabled or for hearing assistance. If you do not provide TTY services, you're not required to provide a number for TTY for those. But this is the number, again, that would be specific to your practice, and this would be written in Chinese. So if we were looking at a Chinese version of this, and one of our member practices did develop this notice of discrimination posting. I'm going to show you that here. Oops. I'm going to show you. So for example, we had Orthopedic Sports and Medicine Center. They're an organization in Houston. They gave us a sample of how they rolled this out. So again, if you speak English, if you speak Spanish, if you speak Korean, if you speak Arabic, there are different language assistants. Here's German, okay? Here is French. So those different language assistant services and the ability to request them are what are called taglines. And those need to be included as part of the postings that we're doing. So that's where we're doing this within this groups. Now, there are questions that are coming up. There are questions that are coming up within this. I'm trying to answer them in line with the material that I'm presenting. So, and I'm sorry, yes, I keep saying notice of privacy practices. I need to be saying notice of non-discrimination, so I'm sorry about that. But this information and how it's being applied is part of that information regarding taglines. Okay, so let's get back to PowerPoint. So again, if we're not providing TTY services, it's not required. Okay, and you are not required to post sign language as an alternative language requesting, because the concept is if there's sign language, they're able to read, and they're able to read the notice of non-discrimination as it's posted. Okay. There was a specific request, a comment period that was part of this, and you're perfectly willing to take this up with the Office of Civil Rights if you feel that this is an overwhelming burden. I'm just trying to inform you of the requirements and how they're expected to be met. Okay, so it's not just your publications that you're producing. This notice of privacy practices and the taglines have to be posted as part of that. Notice of non-discrimination has to be posted on your website. It has to be posted within your practice. It has to include those 15 taglines for the 15 languages in your state that are the most popular or the most commonly spoken languages within your state. And that does have to be posted both physically within your practice and posted on your website. Now, as far as your publications, the keyword, the statement is only required to be published in English on your publications, on your significant publications. And that's that statement that I showed you that does not participate or does not discriminate based on, and the rest of the requirements for that. Okay, so again, TTY is only required if you're participating in that. Any comments on this, Chad? Any thoughts on further clarifications on this?
I think you've actually covered it, and we'll continue to move on and address those next ones, so nothing else to say.
And again, when you're posting within those physical locations, the taglines do have to be part of that. And you can post in multiple physical locations, but you have to be able to, at a common center of contact with your patients and in multiple clinic settings, you do need to make sure that that posting occurs. Okay? So the tagline says that you're producing and supplying limited English proficiency services to those with, again, limited English proficiency. So what's the first line of that? That you must provide oral language assistance to those with limited English proficiencies. You can either use qualified staff to communicate, or you must provide translation services free of charge to those with limited English proficiency. Now, the question had been asked before about written translation. If you decide to provide written translation, it has to be a qualified translator. But oral translation of printed materials can occur. So you do not necessarily need to print all of your materials in all 15 languages or even any additional language if there's not an overdue burden there. So if you have patients that fill out information, if you have a translator who helps translate that form for that patient, or the patient exchange of information regarding forms, patient publications of forms, if you're providing a translation, an oral translation of those forms. But you need to decide what the burden is for you on how you're posting any written translations. So if you have a large population of Hispanic people in your geographic region, you may choose to post some of those in a translated language, but there's no specific threshold for that. So you need to look at your organization and how you're going to meet your patient population and make an accommodation for your patients. So it's not just about non-discrimination, it's also about making sure that your patients are comfortable and that they understand your practice's ability to meet their needs. So if you're providing only oral language, but you have a large patient population in a certain language, you may decide to do forms translation on that. But there isn't a specific requirement. Any thoughts on that, Chad?
Yeah, one thought that I think that we'll want to cover is what exactly is a qualified translator, simply because that's a question that we've got frequently. So I think that it's important to know that the definition of that is someone who translates effectively, accurately, and impartially. Now, a qualified translator adheres to generally accepted translator ethics principles and is proficient in both written English and one other non-English language, including any specialized vocabulary, terminology, and phraseology. So when you're thinking about these documents and who you're having do your translation, you want to keep that in mind. OCR went ahead and did some clarification about what they think about the automatic translation technologies. And the way they said it is using automated translation as the only tool for translating written documents would fulfill a covered entity's obligation only if the quality translator reviewed, or I'm sorry, only if a qualified translator reviewed the translation for accuracy and edited as necessary. So it's important to consider when you're thinking about some of these translation services that are out there.
Now again, I want to clarify with regards to TTY, TTY only needs to be provided for those who are already providing TTY services for those with hearing impairment. If that's something that you've already chosen to supply, you would need to provide that TTY number. As far as the number that's being called for that, for limited English proficiency translation services, that's a number that's supplied by you as to where you're going to triage requests for translation services. You're providing that tagline in a secondary language. The entire notice of non-discrimination does not need to be translated specifically unless you choose to do so, but at minimum, the taglines need to be posted as part of your notice of non-discrimination in those additional languages, again, with a number to call to request translation support. Now, as far as what OCR is thinking, as far as who's going to be answering that phone and if they're going to be able to speak Arabic on the phone directly to request those services, that's not specifically called out by OCR on who's going to be doing that. You may choose to have somebody have an additional service that's answering those phones. That is entirely up to you as an organization about how that phone is answered, and if you're providing language assistance even during that phone call to request language assistance. As far as a qualified translator, that's part of what Chad was just talking about. It's not just enough to be able to speak that language. You've got to be able to use correct phrasing and correct interpretive skills for verbiage contained within medical procedures. So a qualified translator would be somebody who can correctly interpret medical terminology as well as speak the language, and that would be part of of a qualified translator requirement. And again, part of that is the language assistance is in the taglines. So the tagline must say that you're providing these services free of charge. Now, the individual is not required to accept language assistance services, but you must offer them, and you cannot be unduly burdened yourself as a practice. So when they request language services, you are able to set up a certain threshold for that. So I need to have an appointment next week. If translation services can be scheduled for that appointment, then they're meeting that threshold. But the taglines have been converted for you automatically or already within the HHS system. And again, those taglines and the ability to get those taglines are part of that mailing that we will be sending out as well. Okay. As far as finding a qualified translator, your best bet, is providing is support of yourselves within forums or doing Google search for specific qualified translators. But it's effort that needs to be made here. If you're finding that your translator that you're currently using isn't meeting those standards, you may choose to move to a new translation services. But again, part of that is showing effort on your part to meet the HHS requirements. Okay, and the practice or employee size, we're talking about practices of 15 employees or more, are required to have a compliance protocol in place, but it doesn't mean that they're not required to provide language services. So it doesn't necessarily matter the size of the practice. It matters if you're receiving federal funding for this. So all of this, you've done a notice of non-discrimination. You've produced the taglines. You've developed somebody to answer those phone calls to do language assistance. You've got translators in line to meet translation requests for the 15 languages in your state that are the most popular or the most impacting in your state. Then you must have a non-discrimination process. You have to have a compliance process in place. How do complaints get filed? What is that process? So that's part of what you're doing with the last piece of this, which is an attestation. The attestation must be filled out on HHS's site that says that you are doing everything you necessarily need to do, that you are providing this notice, that you are providing the taglines and that they've been posted correctly, not only physically but on your website, that your communications with the patient contain that statement of non-discrimination, that you have a grievance process within your organization, you have a compliance officer assigned to handle grievances for non-discrimination with your practice. That is all part of building this non-discrimination compliance program. Now, non-discrimination compliance and education for your employees is part of what HCP does. Healthcare Compliance Pros under our corporate compliance module includes non-discrimination, includes compliance officer designation, includes grievance process, education for your employees. So all of meeting that necessarily requirement and attesting that you're doing those particular pieces are part of this. The notice of non-discrimination, the statement of non-discrimination, the taglines are all of those links are part of what Healthcare Compliance Pros does when we're supplying this for our clients as well. So that's part of what we're doing. We're providing the notice, the statement, the taglines, providing translation services. That's part of all of this attestation that you're doing under the assurance of compliance. So what is HHS or OCR looking for on this, Chad? What's their overall goal?
As far as the assurance of compliance is just really where you're going to log in on an electronic portal. You're going to log in and you're going to attest to saying, yes, I'm meeting the requirements of Section 1557, in addition to other compliance requirements that they've listed on there. So what they're saying is you've gone in, you're done your postings, you've got your LEP taglines included. If you're at 15 or more, you've got that compliance program in place for the grievance procedures. You're stating that you've done all these things, and you're going in and signing and submitting an assurance of compliance, saying that you met these requirements.
So just answering a question that's been asked multiple times, yes, the slides will be available as well as the links to the services and the support materials. All of those will be provided as part of this process. So what should we be doing? What are our immediate steps to ensure compliance? We need to develop and post that notice of non-discrimination. It needs to include the 15 taglines. Those are the only portions that need to be translated, and OCR has already translated them. They're already up on the website. They just need to be included as part of that. And a note and a sample notice of non-discrimination and a sample statement is included in the materials that we'll be providing to this. Okay? It needs to be both posted physically and on your website and accessible from your home page. Like I said, it needs to include those top 15 taglines. Every state is listed in the links that we're providing of the languages for your state. Okay, so the languages in Hawaii are different than the languages in Delaware or Florida versus Alabama. So that link will be providing you with the 15 languages in your state that you need to provide those taglines. And the locations for those taglines are included in that notice of non-discrimination template that we're providing. You need to determine language assistance services that are available in your area and if they will be requested. Now, one of the questions is, do we need to force a patient to use language services? No, and you cannot require them to do that. If they refuse, you don't have to provide language assistance services, but again, it must be offered. But you should know who you're going to call if an individual requests services. Now, I've seen where there have been instances where you're providing language assistance services through individual family members in small geographic regions, where you've got a mother or father and you're actually working with a son or daughter to provide those services. Now, you need to determine what level of comfort they have in that. Again, if it's a very limited geographic region. But that could be somebody that you're providing those with. The other thing I want to make everybody completely aware of is if you're providing outside language assistance services, you must execute a business associate agreement with that organization. Not just for the information that they're providing on site, but they may be doing scheduling, they may be billing you, they may have information that they're doing and keeping with regards to patients and appointments that were made by patients. They may even choose to provide a summary of services that were provided. So there are lots of different pieces of PHI that business associate may come in contact with and may even keep on external systems. So if you're executing a business associate agreement with them, you need to make sure that you're indemnifying yourself and that organization for those translation services that they're providing. Okay. Covered entities with 15 or more employees must have a civil rights grievance procedure in place. You must train your employees on what the non-discrimination process is within your organization. You must have a compliance officer with regards to discrimination. They must be named, and you must have all of the documentation necessary for a grievance process. And again, Healthcare Compliance Pros, we provide that within our corporate compliance program that meets all those OIG and OCR requirements. So that's part of what is required. Then once all of these other steps are done, once you've got the non-discrimination, the statement of non-discrimination, once you've got the taglines posted both on your physical and your website, you need to make sure that you're visiting the attestation portal to sign off that you're doing everything that you're required to do for those. And I think some of your best parts about this notice of non-discrimination, make sure they're part of that new patient onboarding process. Again, you're doing the financial responsibilities, you're doing the notice of privacy practices, you're doing their patient rights statements. Make that part of that, and you can get that covered fairly easily. So I'm trying to go down the, it does apply to employees with under 50 employees. It implies the grievance process and the compliance program doesn't apply to those with 15 or less employees, but the requirements for non-discrimination apply to anybody who is receiving federal funding, regardless of practice size. Okay. What is the deadline to attest? The deadline to attest is immediately. There is a 90-day implementation time period. That's that October 17th deadline, but the attestation needs to be completed as quickly as possible. And you need to meet that deadline for your attestation, which means all of these other portions of that need to be in place. Okay, and you need to be ready to defend this. This is going to be one of those things that's going to come up with a patient complaint. You're going to get a disgruntled patient. It's going to blow back on you. OCR is going to be looking at what you're doing as far as non-discrimination. That's your biggest exposure here. Okay. Oops. It'd help if I was on the right screen, wouldn't it? Any thoughts as we leave here, Chad? Any thoughts that we didn't cover?
Are there any other questions that came in that we need to address, or have you addressed them during the course?
Well, you know, there was one about, you know, patients bringing family members in to interpret. I did talk about, you know, the fact that there are many times that patients do bring family members in. You need to make sure that if family members come in to interpret, that they're part of your notice, your authorizations for disclosures. Okay, it's under the under HIPAA. They may also be part of disclosures that are made with written statements, and you may be involving them. So if that's what you choose to do, is to bring family members as part of that interpretation process, make sure that they're part of your authorizations as well.
Also, if there's any other questions that they have for us, you can always reach out to us.
Okay. So do the short notices, does the statement of non-discrimination need to be included on emails, Chad? What's your thoughts on that?
No, I wouldn't say on emails, because that's just regular course of communication. I wouldn't think you'd need that. It's not a significant publication.
Yeah, and that's the wording they use. In typical government speak, they said significant publications. Okay, they specifically did a carve out and did address marketing materials. That marketing materials should include the statement of non-discrimination. And again, that language on that statement of non-discrimination is part of what we're providing, but was also brought up in this presentation. So again, healthcare compliance complies with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. This is the sample. So we're providing that 6-point, 8-point, the bottom of the page. You may be doing, you're an equal opportunity employer. There may be other statements that you're doing on those that, again, are part of that legal language in that 6 or 8 point. That's part of what they're providing. Okay. Again, the link to this translated resources for covered entities includes all of those taglines, and if you choose to, you can post the notice of non-discrimination in additional languages, but that is not a requirement. The requirement is that the taglines for the 15 languages in your state be posted as part of that notice. Not only physically, but also on the website should include those postings. Okay? Going down the questions. So at every publication, again, it's what's considered to be a significant publication. And again, it's just the statement that's required. That was another question that came in. It's just the statement that's required, not that the entire notice of non-discrimination be posted, again, with all of those taglines. Only the statement is required on publications that are going out. The notice of non-discrimination, for example, this notice of non-discrimination, This notice of non-discrimination is what we're posting as well as putting on the website. And the table would include every individual language for your state. So there would be an additional statement. I think I did show this example that was produced. This example, I have to thank Joseph Matthews of Advanced Orthopedic and Sports Medicine. He produced an example that meets all of the requirements. So not only have we got the statement and all of the required language, but now we're getting the taglines as a secondary page. And that posting wouldn't necessarily need to be required physically and on your website. But again, the statement is only required on those significant publications and marketing materials. Okay? So let's see if I can specifically sort by so there is not necessarily any liberties with regards to the notice of non-discrimination. The notice has specific requirements, and the notice of non-discrimination requirement contains information that's required. So this is individual language that's part of that notice of non-requirement. That requirement is part of this system. And again, the Fed has already come out with the concept of the 15 requirements for each individual state. So they determined that. It's not necessarily based on a percentage. It's based on the 15 languages for any particular state, not necessarily on a requirement. Okay, trying to go down some of these questions I've gotten. So yes, the attestation is done as soon as possible. As soon as you can meet all of those requirements, you want to make sure the attestation is done. But the requirement for meeting all of these requirements is October 17th, or 90 days. And yes, the version that that Joseph posted for Advanced Orthopedic and Sports Medicine did include sign language, but sign language is not a requirement because the accommodation for sign language is that sign language are people who can read, so that accommodation is taken care of with written communication rather than with oral communications. Okay. All right, so I think I've gone through the majority of the questions. There were more than 150 questions, some of them asked in different ways, the same questions. But at Healthcare Compliance Pros, we will be answering additional questions. We've already received questions via email. And if that's what you choose, it would help if I got the right screen, wouldn't it? If you choose to, go ahead and send us an email. Support at Healthcare Compliance Pros. Call us. I'm willing to do additional research. We've already researching additional questions from a webinar that was done earlier today on Section 1557, again, for the American Association of Orthopedic Executives. So we're willing to continue to do that research. And like I said, compliance and managing your compliance programs is what Healthcare Compliance Pros does every day. This language, this 1557 information was already contained within our corporate compliance programs and had already been addressed. The notice is part of our publication for our clients on October 5th with all of those requirements. So we're meeting those requirements every day for our clients. So if we can help you in any way, don't hesitate to reach out to Healthcare Compliance Pros. We'd be more than happy to not only assist you, a client or not, we're willing to take questions on this 1557 requirement and do some additional research if necessary. I want to thank Chad for taking the time to be on this. He did a lot of the research, he did a lot of the material presentation, and again, if you need any additional help, don't hesitate to reach out to us. This webinar was recorded, it will be posted on our website. If you reach out to us, the links and the presentation and a white paper on Section 1557 will be made available to you as well. Thank you.